that squeeze is a little kinder, and I'd say that's the best part.
Joseph Brant Hospital is now home to a brand new state-of-the-art mammography machine for breast cancer screening.
We're very excited about the new machine here. In addition to a regular mammogram, this machine can do what's called a tomosynthesis. Tomosynthesis is very useful for women with dense breasts, where cancer can be very well hidden and we can't see it. But it takes very thin slices, 1 to 3 millimeter thin slices through the breast, and reconstructs the image so that we can scroll through it, sort of like a CAT scan of your breast, at a very minimal radiation dose. So it's been very helpful for women with dense breasts. So that's one thing. The other thing it does is what's called a contrast-enhanced mammogram. Again, when we're waffling and we're not sure, is this cancer, is this not, we can inject intravenous dye through the vein and then take a picture of the mammogram, do a mammogram, and this will show cancer lighting up among the background of breast parenchyma. So tumors tend to love blood flow, and so this contrast will go to the tumor and make it stand out much better. So it also helps us in our diagnosis.
Recently designated as an Ontario breast screening program site, Burlington's hospital has really focused on the patient experience.
Getting a breast mammogram is not always the most comfortable for individuals, so we really want to take the stress out of it and really reduce people's anxieties. So that involves both the space, it involves providing a warm blanket and a warm gown to individuals just before they go in for their mammogram. In addition, they go into the sensory suite, and in the sensory suite, what we have are those images and sounds to help reduce those fears that people may have when they're having a mammogram.
Local breast cancer survivor Diane Bentavania has noticed a difference between the old and new machines and also really appreciates the Joe Brant approach.
It's a very relaxing atmosphere when you come here. I don't have the anxiety that I've had before, and I find that everybody's very welcoming, from, as I've said before, the smallest things to you get a parking pass. So you don't have to worry, if I didn't have enough funds, would I still be able to go there? The heated gown is like probably one of the best things, because if you're stressed and you have high anxiety, it's just a calming effect for you. You're taken care of. You don't have to wait too long, because that's the other thing I found, that when I come for my appointments, I get changed, I sit there, I'm only there for a couple of minutes, and then they call me, they take me in right away. So that's, I think, the other part of it. It's just calming.
While most mammograms yield healthy results, for those that require follow-up, where you were screened might make a difference.
Because we have surgeons, pathologists, and radiologists all here, they're looking at these images, and at the moment they identify that something requires follow-up, they actually call that patient in and immediately expedite further diagnostics. When you go to an external community site, you may not get that same follow-up so expeditedly because those individuals, those experts are not in those clinics. But here in our facility at Joseph Brant Hospital, anyone who comes through the screening program immediately follows through with the breast assessment center. And that's the quality of that breast assessment center piece. There's quality standards that we have to meet. There's turnaround times in terms of reporting. There's a care and a higher level of care that we provide because we're all here, all the different experts under one roof, really supporting the patient right from that screening to the assessment piece. And that's the benefit of having all of that at Joseph Brant Hospital.
For more information about breast or other cancer screenings in our region, visit hnhbscreenforlife.ca. For Halton News, I'm Jessica Kaitting.